this is Catherine. Welcome to Double O Kidney. If you have chronic kidney disease, there are 5 home remedies and supplements that can help you lower your creatinine level. They can help you lowering your bad cholesterol, decreasing your blood pressure, and ultimately improving your kidney function. And if this seems too good to be true, don't worry, I'll show you the science behind what I'm saying. Because there are studies and researchers showing that the 5 home remedies of today's video can actually help your kidneys. I'll show you what they are in a moment. There is a comment here on Double O Kidney I want to read you first. Catherine, your book about how to beat kidney disease is the best thing that ever happened to me. I've started with the recipes and the recommended fiber supplements, and in no more than 6 months my creatinine went from 3.71 to 2.2. I'm in stage 3 now, and this is the first improvement I've seen in years. And I'm praying every day now because this is a miracle from God. Now I don't know if I need to keep taking the supplement the books recommend, even if I'm in stage 3 now and I can have a lot more fruit and veggies. I've tried lowering the fiber supplement, but I became constipated. What should I do? Hi, thank you, Jason. This comment really made my day. I'm really glad for your recovery, but please keep doing what you were doing before, because very few things really work to improve kidney health. So if you found out what works, keep doing it. And keep us posted about your recovery. Let me know if you keep having improvements. I'll answer your question more in depth in the next part of this video. So today we are going to take a look a bit deeper on what supplements can help you recovering from kidney disease and why. So let's start our top 5 of the most powerful home remedies and supplements actually proven to help people suffering from kidney disease. And since this supplement helped Jason a lot, let's start with it. Number 5, fiber supplements. For most people with kidney disease, fiber doesn't come to mind when thinking of improving their kidney health. However, lots of research has been published showing how fiber, a natural substance in plants, can give the kidneys an extra boost and improve kidney function. There are studies proving this. So, taking supplements like metamucil, citrusal, and fibril can really help you. There are even supplements of psyllium husk, the main ingredient of metamucil, you can find on Amazon for a lower price. But before rushing to Amazon or to your favorite supplement store, let's understand why you need fiber and how it can help your kidneys. Because there are also side effects you may want to consider. Dietary fiber is the main thing all the healthy diets have in common. 2 studies published in the Kidney International Journal shows that a high dietary fiber intake is associated with lower risk of inflammation and mortality in kidney disease. Dietary fiber also has the ability to reduce inflammation and other causes of mortality in chronic kidney disease. Another recent study published in the Journal of Renal Nutrition in May 2013 concluded that increasing fiber intake in CKD patients through the consumption of foods with added fiber, supplemental fiber, can reduce serum creatinine levels and improve eGFR. These 2 studies show that adequate fiber intake is crucial to help your kidneys. By reducing inflammation in the kidney, in turn, the kidney can function better. This is amazing news for anyone with kidney disease. So let's share the good news. Hit the share button to send this video to anyone you know that suffers from kidney disease, because this can help them. Yes, they may want to know that just adding more fiber to your diet through the foods you eat and any supplements can positively improve your kidney function. Now, the best way to add fiber to your diet and lower your creatinine level is through the right kidney diet. A lot of fruits and vegetables are rich in fiber, so if you can, eat more plant-based foods to have more fiber and improve your kidney health. In my slide here, you can see some healthy sources of fiber that are also low in potassium, like apples, for example, or pears, broccoli, cauliflower, and more. I'll talk about how to add a lot of high fiber foods with low potassium you can safely add to your renal diet in my videos about the healthiest foods for renal patients. You can watch them clicking here if you want to know more. And don't forget to subscribe to Double O Kidney and click the notification button to be notified about my next videos. So, getting more fiber from the diet is a great way to improve your kidney health. And this is a fact. There's a huge list of benefits proven to be linked to higher fiber intake, like improving blood sugar control if you have type 2 diabetes, lowering cholesterol, and ultimately improving your kidney function. Now there is just a problem. The recommended daily amount of fiber is 25 to 50 grams. This is what you should consume every day. Now, when I tell people to get 25 to 50 grams of fiber a day, they look at me like they would look at an alien. It's really hard to grasp how much fiber we're talking about. Well, 25 grams of fiber is a lot. You should really plan your diet around this number if you want to lower your creatinine and get back some kidney function. I mean, in an apple, there is about 2 grams of fiber. Just 2. You get to about 4.5 grams if you eat it with the skin. And an apple is considered a good source of fiber. A carrot is just 1.5 grams of fiber. And in a cup of kale, you get 2.5 grams of fiber. So it's no wonder that the average American consumes just 5 to 15 grams of fiber a day, which is way below the recommended amount. What do we learn from this? First, never peel your apples. Second, find a way to get more fiber in your diet. Very few people are able to reach the right amount of fiber every day. Question for you watching me right now. Do you eat enough fiber every day? Do you peel your apples? Let me know in comment section. So, as I was saying, the amount of fiber can be hard to reach depending on how much fruits and vegetables you are consuming every day. But to make it easier, you can also consider taking fiber supplements which come in peel and powder form. Metamucil, a supplement of psyllium husk, is one of the most known and can help with both high cholesterol and high blood sugar levels. It comes in pills, powder, or wafer form. But as I was saying, you can find other brands of psyllium husk supplements that may cost less than Metamucil and have the same benefits. The recommended dosage ranges from 5 to 20 grams a day, usually to be taken with meals. It can have side effects, though, especially at high dosages like gas or bloating. So don't start taking any supplement without consulting your doctor first, okay? Another recommendation is to start increasing your fiber intake gradually. Don't start with the maximum dosage on the first day. These supplements are pretty safe but can interfere with the absorption of other medications like some antidepressants, heart medications, anticonvulsants, lithium, and can change blood sugar levels in diabetics. So talk to your doctor before starting anything new. Time for our number 4. This one is not as widely known as fiber because it's especially useful for people in stage 4 and 5 of kidney disease. Best part is that there are studies showing that it can postpone dialysis up to 4 years if used correctly. Number 4, amino acids. What are amino acids and why are they so useful to lower creatinine levels? You may have heard about amino acids as a supplement for athletes or people doing bodybuilding, right? Well, the amino acids skinny patients need are a bit different from the BCAA and EAA bodybuilders use. Actually, there are special amino acids created just for kidney patients that have been shown to help, especially those in the advanced stages of kidney disease. These are called keto acids. But why would you need amino acids at all, and how are they supposed to improve your kidney health? Amino acids are the building blocks of protein, like Lego blocks of our bodies, except molecular. So protein is the wall of Lego you see here, and the blocks are the amino acids. When you eat protein, your body needs to break it down into amino acids to use it. I know that this metaphor may look too basic for most of you watching me right now, but I really need this to explain why amino acids are so useful, okay? So let's keep in mind this part about the blocks because it can help us understanding why amino acids can help. Protein is made from amino acids combined together like Lego blocks, right? So, amino acids are the single block. In supplement form, they are really useful for those patients on a low or very low protein diet because they can make up for the lack of protein in the diet without putting more burden on the kidneys. Because as we already know, protein metabolism put a lot of burden on the kidneys. The more protein we eat, the more waste is produced, and the harder our kidneys need to work to get rid of it. Most of this extra workload is due to the wastes produced by the body when it dismantles this protein into the blocks it needs, the amino acids. With healthy kidneys, this extra workload is no problem at all. However, if the kidneys are damaged, then any extra work will only speed up its deterioration. So clearly, if we get the single blocks instead of all the workload on the kidneys will be a lot less. Actually, there are several studies confirming that a low protein diet can help you getting your kidney function back. It's a proven fact. Protein metabolism put a lot of burden on the kidneys, so the less you eat, the better, right? This means that kidney patients need to limit sources of protein like meat, poultry, fish, eggs, dairy, and more. But how much should you limit protein? Here. According to several studies, CKD patients need to lower their protein intake to 0.6 grams per kilogram of body weight a day, or even 0.3 to 0.4 grams if aggressive management is required. This means that you really have to cut down a lot. I've talked about this extensively in my videos about the kidney diet, so watch them if you want to know more about the low protein diet for kidney patients. Now, the problem is that this lack of protein in the diet can make you malnourished. This is not a far-fetched theory according to researchers. At least 1/3 of CKD patients suffer from malnutrition. I mean, a kidney diet is really restrictive, and between potassium restriction, phosphorus restriction, and protein restriction, eating enough every day is really hard for the patient, right? And due to the disease's symptoms of loss of appetite, nausea, and vomiting, many CKD patients also tend to eat even less than they should. The problem is that when you are malnourished, you can experience symptoms such as loss of body weight and muscle mass, but also muscle cramping, weakness, and obviously your kidneys will suffer too, because malnutrition is related to infection, right? Patients with malnutrition present with very high rates of infection, and infections are very dangerous in patients with chronic kidney disease. In conclusion, this status of malnutrition is something you absolutely want to avoid if you want to lower your creatinine levels. One way to help solve this problem is through special amino acid supplementation. These are called keto acids, a supplement of amino acids not made for bodybuilders but for kidney disease patients. Using them in a low protein diet will make your kidneys work less because there is no need to break down protein. Amino acids are already broken down. Because your kidneys don't like protein, but your body still needs them. It's a compromise situation that could work, but you can make it work better with these special amino acids. There are several studies confirming this theory. I've put some links down in the description if you want to read the papers. So to get the benefits of a low protein diet and avoid malnutrition, you can use these amino acids. Now, unlike fiber supplements that you can readily buy on Amazon.com, for example, these amino acids should be prescribed by your doctor or dietitian, because they need to be formulated specifically for you. So if you're on a low protein diet and you think you're risking malnutrition, remember that there is a solution. Okay, our next home remedy can keep your heart healthy, can boost your immune system, and will help improving your renal health thanks a better balance in your gut health. And it is number 3, probiotics. Okay, we're in the top 3 now. These supplements will give you some very important results if you want to repair kidney damage. Probiotic supplements in particular have been found beneficial in the reduction of urea in patients with non-dialysis chronic kidney disease. These are the finds of a very recent study about probiotics in kidney disease patients. But what does a reduction of urea mean? Urea nitrogen or bond in your lab values is an important indicator of your kidney function. Urea nitrogen is a normal waste product in your blood that comes from the breakdown of protein from the foods you eat and from your body metabolism. It is normally removed from your blood by your kidneys, but when kidney function slows down, the bond level rises. Now, the patients tested in this study on probiotics were found to have lower levels of urea, meaning that their body was able to process uremic toxins better, reducing the workload on the kidneys. What I'm saying is basically that probiotic supplements are proven by science to help you reducing the workload on your kidneys, giving them the chance to improve. This is not all. Probiotics have some more benefits for your kidneys. Here, probiotics benefits. Help balance the friendly bacteria in your digestive system, prevent and treat diarrhea, can help keep your heart healthy, can help reduce symptoms of certain digestive disorders, help boost your immune system, help you lose weight and belly fat. Now, these benefits are especially useful for people with kidney disease or any other chronic diseases. Actually, since it's harder for them to have a perfectly balanced gut flora. Because probiotics are the good bacteria present in your gut. These bacteria can get out of balance, causing a long list of health problems when factors like stress, taking antibiotics, taking medications, lack of sleep, heartburn, or constipation are present. Now, if any of these factors sound familiar, chances are that probiotics can help you improving your gut health and kidney health, because it's really hard to improve kidney function when you're not getting the right nutrients, as we have seen. And your gut cannot properly assimilate vitamins and micronutrients from foods when the gut bacteria are out of balance. Also, when you have fewer good bacteria in your gut, these will be replaced by harmful bacteria. This will greatly increase the chance of infections. Now, like for fiber, getting more probiotics from your diet is actually a possibility. Yes, eating more sources of probiotics can help. These include yogurt, especially plain Greek yogurt, kefir, a dairy drink, fermented vegetables such as pickles or sauerkraut, and more. The problem with these foods is that they may have too high levels of sodium in the case of sauerkraut, or of phosphorus in the case of yogurt, to be consumed regularly by kidney patients. This makes probiotics supplements more useful, especially for patients in the advanced stages. Probiotic supplements are what were used in the studies I've mentioned earlier, and they are supposed to give you the best results. Most of the studies showing benefits used dosages of 1 billion to 100 billion live organisms, or colony-forming units, CFU in short, per day. If you shop on Amazon.com, you can find several brands sporting even 50, 60, or even 100 billion CFU per serving. So you would have to take just one serving per day, or one serving in the morning and one in the evening, to get the benefits. These supplements are widely used and considered safe. Still, there could be side effects. Probiotics can trigger an allergic reaction or cause stomach problems, bloating, gas, and they can interact with medications. So, as always, talk to your doctor before starting to take any new supplement. Okay, time to see what our number 2 is. This one is actually proven not just to lower creatinine, but even to fight heart disease, lower cholesterol, and even the risk for cancer. And it is omega-3s, one of the best supplements for the health of the kidneys. Omega-3 are responsible for most of the benefits associated with a diet rich in seafood. In fact, few nutrients have been studied as thoroughly as omega-3 fatty acids. They have a huge list of benefits, and all of these benefits are proven by several studies. Omega-3s can protect against heart disease and stroke. It can improve sleep quality, bone and joint health, reduce fat in the liver, and are even associated with a lower risk for cancer. Can fight inflammation in the body and reduce mental decline in the elderly. These are really huge benefits, so you should definitely consider adding omega-3s to your diet. Best part is that omega-3 fatty acid has been shown during several clinical trials to reduce high blood pressure, one of the leading causes of CKD. There is also evidence that it can reduce proteinuria, triglycerides, and inflammation in people with kidney disease. During long-term double-blind clinical trials, this supplement has also shown to reduce the progression of kidney disease in IgA nephropathy patients. Again, if you want to read the studies, there is a link in the description. Okay, how to take omega-3s? The best way to ensure optimal omega-3 intake is to eat fatty fish at least twice per week. Fishes more rich in omega-3s are those that cost less, because omega-3s come from fish oil, and fishes more rich in oil are usually considered less tasty. We're talking about mackerel, herring, sardines, anchovies, salmon. Yes, these are some of the healthiest fishes. But you can also find omega-3s in chia seeds and flax seeds. However, if you don't eat a lot of fatty fish or seafood, you may want to consider taking a supplement. In fact, most of the studies on the benefits of omega-3s use supplements. According to the Food and Drug Administration, FDA, taking up to 2,000 milligrams of combined EPA and DHA per day from supplements is safe. So you can actually just buy omega-3 pills and consume them during meals. Just remember to talk to your doctor first. Omega-3s may have blood thinning effects and other side effects or interactions. Speak to your doctor if you want to use them. Now, before I'll show you our number one, a lot of people here are using this program to improve their kidney function and lower their creatinine. Yes, there are some very inspiring success stories here on Double O Kidney. People were basically able to reverse their kidney disease thanks to what they learned from this program. I'm leaving a link here if you want to know more. And our number one for today, this is a really powerful home remedy you can prepare at home with some really easy to find ingredients, and it is my secret detox tea. This is a very easy recipe with a lot of benefits for your kidney health. If you want to try it, the link to the recipe is here. This is all for today. Thank you